metapneumovirus is a flu-like virus. A medical professional I spoke with compared it to RSV and COVID in terms of symptoms and prevention. Angela Branch, an associate professor of medicine at URMC, says medical professionals have known about metapneumovirus since the early 2000s, but they think it's been around for longer than that. In fact, Branch tells me every winter the virus causes around 5 to 8% of all respiratory illnesses, including bronchitis and pneumonia. Actually, she says we are generally universally infected by the time we're 12, so most people should have some sort of immunity and shouldn't get very sick. However, children and older adults are more likely to experience more severe symptoms than others. Branch says the virus starts out like a typical cold. You may then experience symptoms like fever, body aches, and a sore throat. It should take around 5 to 7 days to recover. Now, as for a future pandemic because of this virus, Branch says it's not likely.
If it were to cause a pandemic, it would have to be because something dramatically shifted in the virus, like some new strain that might have emerged. And there's no evidence that metapneumovirus does that to that extent, the way COVID did during the pandemic. In 2021 and 2022, metapneumovirus virtually disappeared. Like you didn't see any cases. And then when it came back in 2023, it was sort of a very abnormal season. And so, it's not unexpected necessarily that we would see an uptick of cases this year now that it's like the first normal winter season we've had since the pandemic.
As a preventative measure, Branch says you should wash your hands frequently and mask up if you're in a large crowd. Reporting in studio, or on Spitzer, News 8.